Welcome to IMPRES, Imagine Pacific Presentations. This is part 2 of applying the United Nations Disability Inclusion Strategy, fostering inclusiveness, and assessing the impact of digital access on disabilities and marginalized communities. The Inclusion Gap. The COFA, Compact of Free Association Nations, exemplify the type of countries in need of disability inclusion policy as provided by the United Nations Disability Inclusion Strategy. The most recent COFA agreement was signed in 2003 and it supplants the previous agreement signed by the United States in 1986. The next COFA agreement is up for renewal in 2023. Before COFA, there was a trustee agreement between the US and Micronesia that held from the 1950s to 1986. The COFA covers the following countries: the Republic of Marshall Islands, RMI, Federated States of Micronesia, FSM, and Republic of Palau, the ROP. These are all sovereign countries and the citizens of these nations are not United States citizens, nor are they nationals. They are considered non-immigrants, but due to the COFA, they have unlimited entry and exit privileges into the US for as long as the COFA is in place. Other substantial gap areas are health and marginalization that has occurred with a lack of inclusion in the years since the nuclear testing in the region, and despite the adoption of the COFA agreements. Micronesians in Hawaii have a high infant mortality and rate of decreased life expectancy compared to the United States. Standard malnutrition and vitamin A deficiency are prevalent along with one of the highest rates among measured groups of type 2 diabetes. Micronesians in Hawaii face barriers to equal opportunity that contribute to marginalization, as reported in a recent United States Human Rights Commission report. It provided that a majority of Micronesian families earn below the median income level, placing them at or near poverty. Micronesian children make up approximately 1/3 of the total Micronesian population living in the United States. Of these children, 25% are living in poverty, making them one of the highest groups affected by poverty in the United States. Comparing their GDP, COFA nations are ranked 115th for the FSM. The RMI is 218th and the ROP is 220th out of a total of 229 countries reviewed. In terms of lack of inclusion, impact, and digital access, provided is the Digital Equity Declaration, which highlights the lack of digital tools. This document was assembled by the Broadband HUI. It is a consortium of public, private and governmental agencies that gathered together to look at the issue of broadband connectivity and the use of technology in the state of Hawaii during the COVID period, with a concern on isolation and how goods and services were being delivered. They found that 11.8% of the households in Hawaii were without access, meaning they do not have their own internet subscription. They may borrow, piggyback, or go to public areas, but according to HUI's findings, they do not have their own internet subscription. This was considered without access. 9.5% of the households were considered unconnected, meaning they had no internet access in the home and were not borrowing or getting their connection from other means. This was translated to mean these households were not using internet access at all. They found that 7% of the households that were surveyed did not own a computer. They were categorized as the not-haves. The three categories surmised from this survey are the without access, the unconnected, and the not-haves. Drilling further into the data, they found that 19.2% of the households with annual incomes under $75,000, which is below the median area income, surveyed with those categorized as without access, meaning they did not have their own internet subscription. Regarding groupings, they found that Native Hawaiians and Pacific Islander populations, which equated to 13,000 individuals, are without access, and 8.2% or 12,000 are not-haves. And finally, with the Kapuna in Hawaii, we found that 11.6% are not-haves, meaning they did not own computers. The issue here in culminating all this data is that there's a significant gap for a population in Hawaii that either not owns computers, is not connected, or is not readily able to get to the internet, and thus they're not able to participate in the sectors of the digital society that will be presented next. The following sectors are impacted by digital access. Starting with the health sector and telemedicine. Regarding the standard of care, specifically how health is accessed because of the advent of technology and an evolved landscape in the field of medicine that makes telehealth more permissible to entities like TRICARE, the VA, and Medicare for certain medical outpatient services. The next sector is the workforce. Specifically, how the workforce has changed and is shifting to standards where digital access is necessary to participate, where the jobs require use of computers as a condition to enter. The lack of that capability and access not only affects the type of jobs in the new digital economy, but they also develop another barrier to inclusion for those groupings identified earlier as without access, unconnected, and the have-nots. In the educational sector, online education and training, especially during the COVID period, became a requirement for inclusion for children attending public school. Not having a readily available broadband connection affected how students learned, ultimately creating an inclusion gap regarding how the students are able to advance academically due to a lack of digital access. Sectoring of the economy. In turning the focus to online commerce and banking, there is an inclusionary gap that affects those without digital identities, digital history, and readily available digital access. Their inability to establish bank accounts not only makes them a risk for accessing loans, but they also do not have the ability to cash checks and access their funds independently compared to those who have digital access. Shifting to the service sector and those who rely on benefits, entitlements, and advocacy, to include those impacted in the disabled community. For instance, entitlements such as TANF, SNAP, and SSDI, all require some type of means test as these agencies lean towards automated assessment and online verification. And finally, the sector of artificial intelligence. As the world starts to shift, profiles will change as algorithms continue to develop, learn, and evolve. Those who lack digital access will negatively be affected by the digital divide, where they won't be considered bankable, insurable, or trusted with resources due to an absence of digital identity and history. The lack of an established digital profile being developed will cause the AI to overlook or misrepresent them and subsequently create a barrier for inclusion into digital society. Disparity and disability access for the COFA nations, compared to countries like the United States and France, both of which were the principals during the nuclear testing era, is significant. Without access, there are extraordinary challenges COFA families face which could be improved with inclusion. This concludes this episode of IMPRES, Imagine Pacific Presentations. Applying the United Nations Disability Inclusion Strategy, Part 2, The Inclusion Gap. Please like and subscribe, and ring the bell for updates to the Imagine Pacific YouTube channel and stay tuned for more episodes of IMPRES. Thank you very much for watching the Imagine Pacific YouTube channel.